It's a great pleasure to introduce a series of parasitology reels. I'm Dr. Manar Safwat, lecturer of medical parasitology. Starting with Giardia lamblia. Firstly, about transmission by oral ingestion of cysts in fecally contaminated water or food. And for clinical disease, may be asymptomatic or symptomatic. Symptoms are acute diarrhea, chronic diarrhea, foul smelling diarrhea, floating stools, nausea, fatigue, epigastric pain, flatulence, and weight loss. And for diagnosis by number 1, stool ova and parasites, microscopic examination of stool. 2, by ELISA, enzyme linked immunosorbent assay for stool sample. And finally, by nucleic acid amplification test. Finally, when we talk about treatment, Giardia lamblia is preferred to treated with metronidazole 250 mg 3 times a day orally for 7 days, or tinidazole 2 gram orally for 1 day. And in alternate preferred drug option is nitazoxanide 500 mg twice daily orally for 3 days. And an alternative antimicrobials such as bromomycin 500 mg 3 times a day orally for 5 to 10 days, or furazolidone 100 mg 4 times a day orally for 7 to 10 days, or quinacrine 100 mg 3 times a day orally for 5 to 7 days, and finally albendazole 400 mg 4 times a day orally for 5 to 7 days. And resistant strains of Giardia are prevalent, but many will retreat with a different class of antimicrobial therapy or a longer course of the original agent, and in some refractory cases, combination antimicrobial therapy may be necessary. Thank you, and wishing you all of the best.